Hi everybody, welcome back to Style Your Health. I'm Dr. Nandini Sunkireddy. I'm board certified in obesity, lifestyle as well as family medicine. I practice in Atlanta, Georgia. This is the second part of the sleep videos. If you watched my previous video, I talked about the stages of sleep. And today I'm going to talk about what are the negative outcomes if you're sleep deprived. So in my previous video, I talked about ideally you need like 7 to 9 hours of sleep. In that 7 to 9 hours, both the quality of sleep is very important as well as quantity of sleep is also very important. So the quality of sleep is mainly you should have enough deep sleep, enough REM sleep, and you need to have a restful sleep. The restful sleep is you're able to breathe better and throughout the night, and your heart rate is well maintained throughout the night. So if you don't have a good quality of sleep or quantity of sleep, you tend to gain weight. I'm an obesity specialist. I see a lot of people for weight loss. And some of them are like doing the right thing on the diet, like they're following the diet advice what we give, they're doing every exercise possible in the world, but still they're not losing weight. And the first question which comes to my mind is, how is their sleep? So if you're sleep deprived, what happens is there's a hormone called ghrelin which goes up. This ghrelin is a hunger hormone, and there's also a hormone called leptin which goes down, and this leptin is the hormone which helps to suppress the hunger. So when the ghrelin goes up, the ghrelin is one of the most powerful hormones you have ever known, and it possesses your brain, and it makes you crave for more sugars, carbohydrates, and all the junk food during the day. So you tend to eat more rice, more candies, more desserts during the day if you're sleep deprived. And you tend to also eat like 500 calories more than compared to the day when you have. And you can imagine every day 500 calories more, and it adds on. And without your knowledge, you're going to gain the weight which you don't want to gain. If you're sleep deprived, you tend to gain weight. And weight gain makes the sleep deprivation worse. It's more like catch-22. You don't know which came first, but each one is going to complement the other. And as you gain weight and you're sleep deprived, there is a condition called obstructive sleep apnea which sets in. If you look at this picture, the area from the nose to the mouth or the throat, it's called upper airway, mouth to the throat. So any blockage to the upper airway makes you not to breathe during the night. So as a result, your body is oxygen deprived during the night. So when your body is oxygen deprived, the natural tendency is to snore. And as you're snoring and like trying to get the oxygen in, and over the time your body is not able to maintain that. So as a result, you'll have, since your body is not going through the physical repair and the hormonal changes it needs in an effective way, you tend to have conditions called high blood pressure, diabetes. Even people tend to have strokes in the long run, or even sudden cardiac deaths are linked to obstructive sleep apnea. And there are certain warning signs as primary care doctors we look for. And few of them are if your neck circumference is more than 16 inches, or if you're snoring a lot during the night, and if you're getting up in the middle of the night tend to catch your breath, or if you're feeling extremely tired during the night, or if you have high blood pressure and you still, even after 3 medications, your blood pressure is not getting controlled, or if you have diabetes and your blood sugars are not getting controlled even after following the strict diet and being on medications, or if you have strokes, do talk to your primary care doctor about having a sleep study done. And home sleep studies are readily available. Most of the insurances do cover them, so do talk to your primary care doctor about it. Also, there's a myth that sleep apnea can happen only in people who are obese. Sleep apnea can also happen in thin people. So if you have all these signs and symptoms, do talk to your primary care doctor. So sleep deprivation can also have a significant impact on your mental health. And what is that impact? What happens to your mental health if you're sleep deprived? I'm going to talk to you all in the next video. So keep watching Style Your Health MD. It's all about making you feel great. And do subscribe to my YouTube channel, as well as follow me on Facebook and Instagram at Style Your Health MD.